thing that we get a request for is like, hey, can you make me some kind of reduction guide? Yes, we can. We can also make a 3D printed denture template. So we've got trough here, and that basically will go in, and now you can visualize, hey, I've got my implants here, but maybe I need to bring back the correction of the implant with a 17-degree multi-unit. So this allows, for that MUA selection, and it can also serve, the upper at least, can serve as a reduction guide. So there's a couple things that, you got to pay attention to is use existing teeth as a reference point in terms of reduction. So take a measurement. We always provide the CAD file. If you have Exocad, you can download that, or the HTML viewer, but we can take a cross-sectional measurement. We've added 1.3 millimeters of length in our diagnostic wax up. So the teeth, the new teeth, are going to be longer than his current teeth. From the current incisal edge position up, we can take that measurement. So from the new incisal to the cervical, now we have 13 millimeters. If we want to measure from the incisal edge position of the natural teeth to the incisal edge position current teeth, we have a measurement of 12.4 millimeters. Using these as visual reference points is nice because you can do a facial reflective flap, release that tissue, and then just take a pencil and you can mark, or you can take a surgical crosscut and mark. Having 2 existing implants is also a really good reference. If you were going to use the denture, you can take a measurement from the incisal edge, and let's say the standard is 15 millimeters. You're going to measure 15 millimeters from here, which is typically about 4 millimeters, 4.5 millimeters above the cervical, and then mark there. And so we can also make a digital cut in here as a reference point for a digital bone reduction guide. And the same thing for the lower, for the MUAs. It's just that when you're reducing lower, these don't serve well as a reduction guide. So again, going back through and taking cross-cut measurements and going off existing teeth. So when we're talking about the digital treatment planning and the diagnostic photos, retracted photos are great. I really like to see that smile photo, full exaggerated smile. A lot of these patients, they don't want to smile if they have teeth that kind of look like this, but you can see here with that vertical height of where the existing implants are. That's why we chose to use these implants and incorporate these in the hybrid. So here's the retracted smile, and then we also have a full smile here, and then our full smile. Come in here in this edit tool, and then you can kind of resize and crop everything. So we've added, like I said previously, we've added about 1.3, 1.5 millimeters of length in the design. We wanted to show a little bit more teeth, but photos are very important in the treatment planning of these full arch cases or in any cosmetic treatment plan.